Hi everyone, we are here live on the 5th floor of Bay Area Regional Medical Center in the Women's Center, and I am here with Megan and her very gorgeous daughter, Daphne. Isn't she amazing? Oh, everybody say aw. Comment below aw. She's so sweet. So we are live, and so if baby Daphne decides that she needs some milk, we're probably going to stop and then come back. All right. So we are super excited to be live today, and I don't know who that is back in the back, but that happens. It's all good.
Sorry.
Oh, Dr. Figueroa, come over and say hi. Stick your head back here.
What
we
are
are live.
Here? Are we live?
We are.
Hello.
So Dr. Figueroa is Megan's OBGYN, and she helped deliver. So Daphne is one of the first babies born here at Bay Area Regional. We are so super excited to be delivering babies and have these, oh, they're just so amazing. I'm so excited. So I wanted to go live and ask you a couple of questions about your experience and what all you thought about this whole thing, because no one else like, I posted some pictures the other day, but no one's really seen it yet. So I'm super excited to get your experience and just kind of talk a little bit.
Yeah.
Cool.
My experience here was amazing. Like,
Yeah.
I couldn't have asked for a better hospital, for a better doctor, honestly. I'm truly blessed with how wonderful and how well I was taken care of. All the nurses were amazing. They helped me through my rough patches, and then after the rough patches, they're like, "You're so great, you're doing great," and I'm like, "Thanks," because I feel like I'm doing horrible. But they were all absolutely amazing, very tentative. They came in randomly just to ask how I was doing. They didn't have to do anything to me or, check blood pressure or anything. They just wanted to know how I was doing, and they just took care of me really well.
That means so much. It really does. By the way, you guys, I didn't mention this earlier, but look how amazing she looks. Like, I wish I looked like that right after I had a baby.
That's exactly what I was just thinking.
Thank you.
I'll let you girls get back to the interview. I'm going to come check on you later.
Okay,
sweetie?
thank you.
Thanks, Dr. Figueroa.
Uh-huh.
So tell me about your whole process when you came in and all of that. We were talking a little bit about your story earlier.
Yes, so I was a week overdue, and we didn't know how big this girl was. She felt like she was huge, so we didn't want to go any further than that.
Yeah.
And it took me 24 hours to have this child.
Oh my.
Yeah.
Oh, that's oh.
Yeah, it was,
really?
So the nurses helped me through, labor, because I wanted to try to go as far as I could without having an epidural.
Mm-hmm.
I knew I was going to get one, but I didn't want to be in bed forever. So I stuck it out for 10 hours, and then I was dying. I was like, I can't do it. When I started crying, I was like, it's time.
Yeah.
I shouldn't have waited that long, but I wanted to try to get as far along as I could.
Mm-hmm.
The Pitocin, was difficult, but I made it. Many women have had babies before. Like, I could do it.
Yeah.
If they can do it, I can do it.
Yeah.
And but the nurses during the hard parts of my labor, they were just so encouraging. They helped me try to move the process along, and unfortunately I wasn't able to. And in the morning when they came and checked me, I went from a tight 7 centimeters dilated to a 6. And then the baby's head was tilted, so she couldn't get through the birth canal safely. So we had to do a C-section.
Oh, wow.
Yeah, but the anesthesiologist came in. Well, when I got the epidural, he came in, and he was my hero for the day. He was absolutely amazing. I couldn't say anything better about him. He kept me calm. He did it as fast as he could, and he made jokes.
That helps so much, because you're like bent over and they're like, stay still, and you're like, I can't stay still. I'm having a contraction.
Yeah, exactly. But he took his time, but quickly. Does that make sense? He didn't try to rush, but he made it happen fast enough that I wasn't in pain for too long. Yeah, but he was my hero for the day. And
that's awesome.
What I liked most is that everybody was human. Like, all the nurses, the doctors, they're all human, and they're not like, I'm not just a number.
Yeah.
I was actually their patient, and that was very comforting.
That's a big deal.
Mm-hmm.
And side note, she had the first baby in this room.
Yes.
Yay, that's so exciting.
I know.
Daphne, you're just so awesome. She doesn't know it yet, but she is.
Baby.
She is so cute too, by the way.
Thank you.
So, talk to me about the nurses and how they treated you and how you felt along the way.
They were just truly amazing. I couldn't ask for better nurses. Like, I want to get them all, like, a gift.
Aw.
I need to, because they deserve it. They worked really hard with me. They were just absolutely amazing. I couldn't have asked for better care.
So you were talking about, like, a ball and something else. I didn't really use anything like that, so talk to me about that. Describe that.
So there's, like, a Bosu ball, like a
Okay.
big bouncy ball,
Yeah.
and, you know, you sit on it and you try to bounce and you try to, like, move around, and they just, like, explained everything very well, so I was able to understand why I needed to do it. They made sure I tried walking around, and they just told me what I needed to do to push the labor along.
Mm-hmm.
There was also these, once I had the epidural, you know, you can't get out of bed.
Yeah.
And so they had these, like, peanuts, these big, it's like a Bosu ball, but it looks like a peanut.
Okay.
And it, you know, they put it between my knees and just to try to open my cervix to help the process.
Yeah.
And unfortunately it didn't work.
Tried everything possible.
We tried everything possible, but after 24 hours I had to have a C-section.
That's like so, that seems like so, but you weren't like in labor hurting for that long, right?
I was in labor hurting for 10 hours.
Oh my gosh. Wow.
Yeah.
Well, God bless you.
Yeah.
Whenever I was having my son, I said, you know, I walked in and said, I think I'm having labor. And they said, oh, you're 4 centimeters. I was like, yes, give me an epidural right now. So they're like, hold on, we got to do a few things first. But that was awesome. Mm-hmm. So it really does make a difference. So I'm not saying that it's bad or good or whatever. So if you're out there and you're watching, you know you have a choice, and that's what's so great about this unit too, is that you can have a birth plan and you can have some things laid out that you'd like to try, and know that, you know, if things get to 24 hours and you know, so you might have to go to plan B too.
Well, also all the nurses are like crazy experienced. They have like 15 plus years. One nurse had 18, and I'm like, that's awesome, because you want somebody who knows what they're doing, and they all do. They're like, girl, you're not going to have this baby. Like, they knew I wasn't going to have the baby quick, which I was like, oh, I'll have her by 2 o'clock in the afternoon. And they're like, girl, no.
Oh.
Like, maybe 3 in the morning. And it was 8:30 the next day. So they know what they're talking about. They know what they're doing. It's just, that's another thing that's so comforting. Yeah. That
does make a big difference. So say I'm your best friend and we're talking about, you know, we don't have to name any other hospitals, but there are some other options out there. So what would you tell your best friend?
Well, I had one come last night, and she was telling me where she went, and she was just looking around and saying how clean it was, how clean this place is, and how gorgeous it is, and how huge the rooms are, because the rooms are smaller at other hospitals. And I was telling her that most hospitals don't let you bring kids, don't let other people bring their kids unless they're siblings. And I was able to have my nieces and nephews. Aww. And that was like 6 kids at one time. Yeah, so it was just sweet and amazing.
That makes a big difference.
Yeah, and I also was talking to another friend who's pregnant now, and she was just like, oh, yeah, I think I might go there.
Oh, yay.
Yeah.
Awesome.
Yeah.
Well, make sure you tell her we are doing tours now. So you can tell her to, there's a phone number you can call, or she can just come to the main entrance, the welcome desk at the hospital, and say that she wants a tour. And they'll take her up to the 5th floor and give her a tour right then and there. So if she wants to come, tell her to come and take a tour, because it's amazing.
It's really, truly amazing. Yeah.
And it's, I mean, there's these couches that turn into beds, there's a glider, and there's so much space. And you know what I really like? The bathroom is like 3 steps away from the bed right here. So when you're a mom,
after a C-section and it hurts to walk. Yeah, it really does. But everybody who came in was like, oh my gosh, these rooms are huge. I mean, we had 6 kids, 4, 5, 6 adults in the room, and it was comfortable for everybody, you know. And they're like, like amazed with the bed because it's like extended and it gets out long, and it's just comfortable. It's clean. It's just amazing here.
Awesome.
Yeah.
Well, cool. I'm going to see if there's any comment. I don't see any comments below, so we don't have any other questions along the way. But if you have any comments after the fact, I'll be happy to answer those. Thank you so much, Megan. You're awesome. And
Oh my.
was she sleeping good? Oh my goodness.
Oh,
Congratulations on your new baby girl.
Thank you.
That is so awesome. Oh. So anyway, we'll talk to you guys later. Have an awesome day. Thanks so much.
Bye.